Hey everyone, and welcome back for another deep dive. This time we're going to be tackling a topic that's, well, pretty crucial in the world of healthcare.
Yeah.
It's medical coding, but not just any medical coding. We're going deep on congenital malformations, deformations, and
Chromosomal abnormalities.
chromosomal abnormalities. That's right.
Yeah.
And you know what? Looks like you've been studying up on the Absolute Medical Coding Institute's Medical Coding Guidelines, the MCG manual.
That's a good one.
Smart move. We've got it linked down in the description if anyone else wants to follow along. I got to say, medical coding, it's a whole world of its own.
It really is.
But it's so important to get it right, you know?
Oh, absolutely.
And that's why we've got our expert here to help us break it all down.
I'm happy to be here.
So we're diving into Chapter 17 of the manual, which is all about coding these congenital conditions, those that are present right from birth.
Exactly.
What's the big picture here? Why is this chapter so important?
Well, Chapter 17, it's all about making sure that we're capturing these conditions accurately in the codes, whether they're diagnosed right away when a baby's born or if they're discovered, later on in life. And that accuracy, it's not just about, paperwork.
Right.
It has a real impact on patient care, research data, and, of course, billing.
Yeah, because using the wrong code, that could lead to some pretty serious consequences, I imagine.
Oh, absolutely. I mean, think about it. If a patient needs, say, specialized treatment for a congenital heart defect, but the code's not right,
Yeah.
it could delay authorization for that treatment or even in some cases lead to the patient being denied coverage.
Wow.
And then on a larger scale, inaccurate coding, it can really skew research data,
Yeah.
making it harder to understand how common certain conditions are and how to allocate resources effectively.
Yeah, that makes a lot of sense. And so in this chapter, we're dealing with codes Q00 through Q99, right?
That's right.
And one thing that I think trips people up is that these codes, they can be either the primary diagnosis
Yes.
or a secondary diagnosis. It just depends.
Exactly. It all depends on the specific situation.
Could you maybe give us an example of how that would work?
Sure, yeah. Let's say you have a newborn who's admitted to the hospital with pneumonia.
Okay.
And during the examination, the doctors, they find a heart defect that hadn't been diagnosed before.
Oh, wow.
So in that case, the pneumonia, because that's the reason the baby was admitted, that would be the primary diagnosis.
Okay.
The congenital heart defect, while it's super important, that would be coded as secondary.
So it's really about what's the main reason they're there at that point.
Exactly.
And then Chapter 17 also gets into coding manifestations.
Yes.
And I think that's where it gets especially complex.
It can be a bit tricky.
Can you, break that down for us a little?
Sure. Manifestations, those are the additional health issues that come up because of a congenital condition. So think of it this way. Down syndrome, it's like a puzzle. And certain pieces, like heart defects, those are almost always part of that puzzle. So we wouldn't code those separately.
Got it.
But then you have other pieces that might come along later, like, let's say, hypothyroidism. Those are additional manifestations and need their own codes.
Oh, that's a really good analogy. That makes a lot more sense. But what happens when you're dealing with a manifestation that develops much later in life, maybe even decades after birth? How do you code that?
That's when things get really interesting and really important for accurate documentation. We need to be able to connect the dots,
Yeah.
We have to be able to show that this later condition is actually related to that original congenital condition.
It's like medical detective work.
It can be, for sure. It often involves going back and looking at the patient's history, talking to specialists, and sometimes even doing genetic testing.
Wow. Are there any, common mistakes that coders make when it comes to manifestations? Pitfalls to watch out for?
One of the biggest ones is coding a manifestation as the primary diagnosis when it's really the congenital condition that's driving the whole healthcare encounter.
Right.
For example, someone with Down syndrome might come in because of breathing problems, and it turns out it's related to a heart defect.
I see.
So while the breathing problem is the immediate concern, the heart defect, which is a common part of Down syndrome, that should actually be coded as the primary diagnosis.
Oh, so it's even though that's what brings them in,
Exactly.
that underlying condition is still the root of it.
You got it.
And this brings us to something I thought was really interesting in the manual. It emphasizes that these codes, they're not just for newborns.
Right. It's a common misunderstanding. But we use Chapter 17 codes throughout a patient's life, even if the condition wasn't diagnosed until they were adults.
Wow.
What matters is that the condition was present from birth.
So even if something has been corrected, like surgically repaired, it still influences how we code.
Absolutely. Let's say a child had a cleft palate that was fixed when they were little. We would use a Z87.7 code to show that they have a history of a corrected congenital malformation.
Okay.
This is really important information because even though the cleft palate isn't there in the same way anymore,
Yeah.
it could still have long-term effects on their health.
That's fascinating. I bet a lot of people wouldn't think to use a code for something that's been corrected. Is there like a certain amount of documentation that you need to have to use a code like Z87.7?
Oh, yeah, absolutely. We can't just assume a condition was present at birth.
Right.
We need clear documentation. Things like operative reports from the surgery, medical records from infancy, or even confirmation from a specialist.
I see.
This ensures that we're not just guessing,
Yeah.
We're basing our codes on actual evidence.
That makes sense. And this idea of lifelong coding, it brings us to a special case, birth admissions. What are the guidelines for coding those?
So for birth admissions, the order we code things in is super important. We always start with the Z38 code for live birth. That's the primary diagnosis.
Okay.
Then we list any codes from the Q000, Q99 range, those for congenital anomalies, as secondary diagnoses.
So it's like a specific sequence.
Exactly. Sequence matters a lot in medical coding.
Well, this whole deep dive has been so insightful. It seems like Chapter 17, it's not just about codes, it's about a whole way of thinking about patient care. It's about seeing the big picture and understanding the long-term impact of these congenital conditions.
I couldn't agree more. It's about recognizing that these conditions, they don't just vanish, They can shape a person's health throughout their life, and our codes, they need to reflect that.
And for anyone listening who wants to learn more, remember we've got that link to the Absolute Medical Coding Institute's Medical Coding Guidelines MCG manual in the description. One thing that really stuck with me from the manual is that some congenital conditions, they might not be diagnosed until later in life. What does that mean for healthcare professionals?
That's a great point, and it means that taking a thorough patient history is so important.
Right.
Even when a patient comes in for something that seems totally unrelated,
Yeah.
you never know. There might be clues to a congenital condition hidden in their past. And finding those clues, that could make all the difference in providing the best care.
It's like connecting the dots.
Exactly.
Well, on that note, I think we'll wrap up this deep dive. Thanks for joining us, and keep those codes accurate.